Hello, and welcome to the first installment of the Psychedelic Pharmacists Association Interview Series, where we meet and learn from leaders at the intersection of pharmacy and psychedelics. I'm Michael Haichin, one of the co-founders of the association. Joining me today is Dr. Kelan Thomas, a board-certified psychiatric pharmacist and an associate professor of clinical sciences at Touro University, California, College of Pharmacy. Thanks for taking the time, Kelan.
Sure. Thanks for having me.
So to start, could you tell us a bit about yourself, such as when you graduated, where you work, and what you do in your day-to-day role?
Yeah, sure. I completed my pharmacy degree at UC San Francisco, and specialized in pharmaceutical sciences there, and started to do some research related to psychiatric pharmacogenomics, which at the time was a thought to be a new novel way that might help optimize and improve mental health pharmacotherapy. So I'd always had this interest in mental health and pharmacotherapy. And so then essentially that led me to residency training at University of Michigan, where I also completed a master's in clinical research and continued some of that psychiatric pharmacogenomics research. Then I practiced in Singapore for a year and then came back to do USC in LA County PGY2 in psychiatric pharmacy residency there. And then eventually was waiting and found that my current faculty job that I joined the faculty in 2013. And, over the years, there's been more and more movement and shift toward psychedelics. And certainly the Bay Area is a pretty active spot in terms of that. So I started attending talks and lectures and things and sort of moved my scholarship into that domain. And then in terms of sort of like week to week, obviously pre-COVID is more exemplary than right now. So usually my schedule would be like Mondays, I'd go over to UCSF and work with the clinical trial team over there that did the psilocybin and HIV/AIDS survivors study. And then Tuesdays, I'd have San Francisco VA downtown clinic is one of my primary clinic spots. Wednesdays would often be trips to campus, faculty meetings, things like that. Thursdays, I have a federally qualified health center here in downtown Oakland that I go to and provide care there. And then Fridays would sort of be, catch-all, writing, research, consulting, all types of different activities and things like talking and doing interviews like this.
It's quite the career path and also quite the diversity of roles. It sounds very interesting. So you touched a bit on this, but what led you to become interested in psychedelics and how did you get involved in psychedelic clinical research?
Yeah, so probably what first piqued my interest was reading Aldous Huxley in high school. So I was, doing AP chemistry and things in high school. I had an interest in chemistry and pharmacology, which is what I did my undergraduate degree in at Duke. And so I've always had that interest in psychopharmacology. And then I started reading essays from Huxley and this famous novel called Island, which was this idea of how to integrate psychedelics into society. And so that kind of always stuck with me. But I just sort of went along and was doing, was interested in psychopharmacology, mental health, things like that over the years. And then it wasn't till, maybe shortly after, right around the time that I moved here in 2013 was Psychedelic Science conference, started to learn more about it, started attending more conferences and talks and realized that, yeah, this is something that actually pharmacists can contribute a great deal to in this translation between a lot of the basic science into the clinical care realm. So there's a lot of people on both sides, but pharmacy is uniquely positioned, I think, to help transition between basic science and translational research into clinical care.
Absolutely, I agree wholeheartedly. And that leads to my next question. Assuming regulatory approval of compounds like MDMA and psilocybin, what do you envision as the future roles of a pharmacist surrounding psychedelic-assisted therapy?
Yeah, I think it'll be, a little bit like my role now where I, be part of an interdisciplinary team, maybe sometimes talking to clients one-on-one, but this aspect of how does the day and workflow build around psychedelic assisted therapy is sort of a novel, thing, very unique in healthcare and healthcare systems. And so there are clinics out here in the Bay, a variety of ketamine assisted therapy clinics that have cropped up. And so people are building these models and trying to think about ways that are sustainable. But I see the pharmacist as a key consultant in that role of thinking about how do we manage the other medications they're taking? How do we watch out for drug interactions? Do we need to consider tapers for certain psychiatric medications to for both safety concerns and efficacy concerns? So there's been, the big study that came out showing how MDMA benefits may be mitigated by recently tapering off of antidepressants. So these are all, questions that remain to be seen, and we'll see more with continued clinical research. But I think that's how a pharmacist will be similar to what a psychiatric pharmacist would do, but a little bit more unique in terms of the types of questions and clinical scenarios we're considering that are different than sort of the standard of care right now, which is prescribing a daily medication in most cases.
Thank you for your perspective. So to my knowledge, you're the only PharmD in the world with the certificate in psychedelic assisted therapies and research from CIAS, the California Institute of Integral Studies. What is this certificate good for? What was the process for obtaining it? And is that the type of training and education that you would recommend for other pharmacists?
Yeah, so the CIS program, they had started, a lecture series, and then the faculty of this program, were basically all of the people's papers that I was reading. And so for me, it was about the ability to have interactions, ask questions with the faculty, and find a mentor. That was a big part of the process. So CIS also has a mentorship program as part of the certificate. And that linked me up with Brian Anderson, who is the psychiatrist that I worked on the study at UCSF with. So
Yeah.
exactly. So
Yeah.
so really in that regard, it was incredibly useful for me, in terms of, building up and explaining what my skill set was. And I think in the future, yeah, psychiatric pharmacists that have the necessary hours of clinical training, that's one of the things that's unique about the program, is that you essentially have to have pretty well established in your career, as opposed to a lot of other programs. You're starting with that. This is almost like a mid-career, people who had been in professional practice in mental health capacities for a while. So in that regard, I think it was very useful. And I think those types of trainings are going to be useful. There's other organizations that are coming up with their own educational programming out there. And then at the end of the day, what's going to be interesting is how the FDA REMS rolls out for MDMA and psilocybin, which will also, I'm sure, require another level of training that would be at, essentially with the manufacturer. The manufacturer in most of those cases has to be responsible for setting up some type of infrastructure that tracks and essentially credentials, almost like an X waiver for things like Suboxone, for example. So though there's going to be something about that FDA REMS that dictates some level of qualification or training. And so before that all happened, CIS at the time for me was the best option.
Yeah, you brought up the REMS discussion, and that'll dictate a lot of how this gets integrated into care. So it will be interesting to see how that plays out for the different compounds and their respective REMS programs.
Yep.
So what is the role of music in psychedelic assisted therapy? And can you tell us a bit about the playlist that you've designed in the past and what that process was like?
Yeah, so that's an interesting side interest of mine, that actually when I was an undergrad, I took a lot of musicology coursework and was a college radio DJ, playing all types of different freeform music, and just, studying music the same way that I would study pharmacy, essentially, or pharmacology. So that's just been a long interest of mine. And I think it is an important part of this process. And there's still a lot to be learned of, doing sort of arms that don't have any music, for example. We don't have that in any of the trials at this point. So that'll be interesting to see, is there some effect? Mendel Kaelen's doing a lot of work on this. He's sort of the expert of this intersection between the neuroscience, the psychedelic experience, and the music. So I think it is important, and it's something that I've always been fascinated in using music as a means to more fully express emotions, like if you have an emotional state, to lean into that with some type of music that further enhances that. And that's what a lot of the music therapists are talking about, is that sort of resonance with emotional state seems to help with the outcomes and things in terms of emotional improvement of symptoms. So that's sort of how I got into that. It's always been an interest of mine, and I actually wrote my CIS final paper on the few articles that have been published from the early studies, like Walter Pankey and Helen Bonney, who is a music therapist that's really worth reading that work, and thinking about how all the playlists have been put together thus far and all the different trials. And so that informed the way that I approached helping to coordinate the playlist for the UCSF trial as well.
Oh, so you actually produced the ones for that trial. Very interesting. I didn't know that.
Yeah.
And
along with the team
okay.
of people. It wasn't just me, but I took the lead in helping to coordinate that.
So you're involved in the Students for Sensible Drug Policy's Psychedelic Career Development Pipeline Mentorship Program. Can you tell us a bit about your goals for that program and any other mentorship initiatives that you've been involved in?
Yeah, so SSDP is, I learned about through the Drug Policy Alliance and other policy, groups that have been organizing in various ways around drug policy, which is obviously goes very much hand in hand with this idea of psychedelic-assisted therapy, given that these drugs are all considered Schedule I substances with no use. And so the war on drugs, as everyone knows, has been an abject failure. It's wasted money. It's incarcerated people in outrageously high rates. And so the more that I thought about it, I wanted to find people to help get them more into the psychedelic-assisted therapy career paths that had this policy lens or had these basic ideas in play. We're doing things locally at their university to try to educate people, because it's a big problem that people are just very uneducated and misinformed. There's essentially disinformation program around a lot of these drugs like LSD and psilocybin, et cetera. And so that's something that was important, and something that I also do in my volunteer time. I spend a lot of time with decarceration coalitions at the state and county level for jails and prisons in California, because it's all tied up with mental health as well. So about 40% of people from my county here in Alameda and Oakland, 40% of the people in jail or state prisons from my county have a mental illness.
Wow.
And to me, that's just a failed social policy at every level, and it's got to change. And so part of that is giving mentorship for people that are aligned with those goals and thinking about shifts in drug policy that I think need to be happening simultaneously with this emergence of psychedelic assisted therapy models.
Yeah, I agree wholeheartedly that a drug policy perspective is needed as we consider integrating this into clinical practice, just because we can't forget that, as you said, there's still illegal drugs and there's a lot of harms associated with the war on drugs that, are frankly a huge mistake.
Yep.
So what advice would you give to future or current pharmacists wanting to get involved in the psychedelic medicine industry?
Yeah, I mean, it depends what your, goals and background. So that's the other piece, is that a lot of people are thinking, oh, I have to go become a psychotherapist now. That's one role, and obviously a critical role, but I would think about what are the skills, what are the types of things that you like to do, and chances are there's a way that can translate into psychedelic medicine in some way, shape, or form. But in the pharmacy realm, I think your best chance of an impact is if you are interested in psychiatric pharmacy. There's already a clear pathway, clear training, credentialing, et cetera, to do that. And obviously that's where most of these indications are going to occur, for MDMA with PTSD and psilocybin for depression. So I think that's the best way to approach it. But at the same time, if you're at, an undergrad level currently thinking about a pharmacy career, or in grad school, find the local community organizations or your chapters of SSDP or other local groups that are bringing in people to give talks. People, that's really what I did, was just immerse myself in, going to see more lectures, meeting people at talks, just sort of building a community around people that have this interest in changing drug policy and finding a new paradigm of mental health treatment with psychedelic assisted therapy.
And if you could educate people about any specific thing related to psychedelics, what would you choose?
Well, what I have chosen is I've written 2 articles for Chacruna Chronicles, because one of the things that anytime I meet someone that doesn't know what I do, I explain that, and they're like, "Oh, you mean like microdosing?" And we really need to be very careful about microdosing. We have no evidence whatsoever of benefit, and there is a couple potential risks depending on what drug you're microdosing with. So I've put out this idea of the serotonin 2B receptor and potential heart valve issues. So the idea that people want to take this model, which yes, people have been taking psychedelics for a very long time, but have they been taking them every 2 days for years at a time? Not to my knowledge. I don't know people that have been doing that routinely, or a good database that has demonstrated safety and efficacy with that. So that's, to me, the biggest thing is be educated, understand what you're doing. If people are out there just taking psychedelics in a microdosing format, be educated, understand what the possible risks and benefits are. And that's what my education has been around. I just recently did a psych ed talk about this issue, about what are the potential risks. So that's really what I want to get out there. And then all the other research I'm doing is related to better understanding adverse effects and drug interactions and all these things that will be important for clinical pharmacy to interface with the psychedelic medicine industry.
Yeah, and I think that's an incredibly important subject to discuss. So I encourage all the listeners to go check out Kelan's article on Chacruna. It's Why Chronic Microdosing Might Break Your Heart. Definitely worth the read. And thank you, Kelan, for your time, and look forward to speaking again in the future.
All right. Thank you, Michael. Appreciate it.